Hi everyone, it's morning 7:22 today. It's New Zealand time in the morning. So our topic today, we're going to talk about what is the risk of another miscarriage. Okay, this is our main topic today. So what is the risk of another miscarriage? Then we're going to talk about what happened if you miscarriage. All right. Again, right. This is our topic today. So when you come in the live, please give me a thumbs up and say hello to me. And please share this video. If you're on Instagram or Facebook, please share it with your friends and family. Share on the post. If you're on YouTube, please say hello to me and give me a thumbs up. Thank you very much. I just received some Mandarin from a neighbor. It's pretty nice one. Well, it's winter time, but we got Mandarin. It's a local, no spray, so pretty organic. Okay, now let's start with the topic straight away. Now we talk about the cause of miscarriage is spontaneous loss of pregnancy before the 20th week, right? So many miscarriages occur because of the fetus isn't developing normally, right? So we talk about all this. And problem with the baby's chromosomes are responsible for about 50% of early pregnancy loss. Okay, so that is pretty high. But we need to think about things like chromosomes things that happen 50%, and that can a conjunction with blood deficiency according to Chinese medicine. So also we need to build up the blood system before you consider to get pregnant again, right? So most of this chromosomes problem occur by chance is the embryo divided and grows, right? Although it becomes more common as women age, but sometimes a health condition such as a poor controlled diabetes or a nutrients problem might lead to miscarriage. Often, however, the cause of miscarriage isn't known, is it? Yeah, we talk about all this, right? Now, miscarriage is usually a one-time occurrence, but most women who has miscarried go on to have healthy pregnancies after miscarriage. So that is pretty good, isn't it? It's a good news that we talk about that too. So a small number of women will have repeated miscarriage, happen again. That's about 1%. That's about 1%, right? So not much, but that is very sad for those 1% because you really want to find out the reason. Okay, the predicted risk of miscarriage in the future pregnancy remains after 20% remains about 20% after one miscarriage, right? So it happened again is about 20%, and after one miscarriage it will happen again, right? So that is about 20%. Okay, and after two consecutive miscarriages, the risk of another miscarriage increased to about 28%, right? So that's pretty high, isn't it? So, and after 3 or more miscarriages, the risk of another miscarriage is about 43%. So yeah, we have patients who had 2, 3, or 4 miscarriage, and that is very sad. And in this case, we really want to find out what's going on, isn't it? But sadly, most doctor would suggest that you get all the tests after 2 miscarriage. So what is the point? I would say get all the tests done after 1 miscarriage, so get your ultrasound, blood test, chromosomal test, and hysteroscopy, all this thing, especially the blood test. Most of the time, the blood test can rule out what's going on. Hi, Veronica, how are you? Thank you for joining us. So this is very, very important, and sometimes you need a MRI to rule out things as well. So yeah, I would say you probably, I always say that for the doctor didn't suggest the test earlier, and after 2 miscarriage, they started suggesting, oh, then we need to do some genetic tests and blood tests, all those things. Then I would really say after just one miscarriage, and you should do all these tests to rule out, because most of my patients, none of them has been done any test after 1 miscarriage. And this is important because you don't want it to happen. If that is a genetic issues, then hey, and IVF is the best choice for it if it's genetic problem, okay? And if that is an autoimmune problem, a blood clotting disorder, or hormone level, like the thyroid and progesterone issues, the progesterone doesn't produce properly, and it can't hold the baby. It can't hold the fetus at all. It can't help it to grow. And all the blood tests showing the hormone level, like thyroid and progesterone and blood clotting disorder and autoimmune problem, and acupuncture and Chinese medicines are the best treatment for it, for hormone problem, right? So be in mind of this, like if miscarriage that causing from the like fibroids, so then we know the fibroid need to remove to make sure that conceive again, So if you or your patient have just 1 miscarriage, then I personally, when we practice, we actually get patient to run all those tests, to run all those tests, at least the blood test that you need to do and the genetic test, we need to do this, right? So this is trying to rule out what's going on and then prevent the next miscarriage. If you know what's going on, then we can prevent it, right? If you don't know what's going on, then we don't know how to prevent it. Okay, so when is the best time for pregnancy after miscarriage, right? So miscarriage can cause intense feeling of loss. It's awful. So you and your partner might also experience sadness, anxiety, or guilt. So don't rush the grieving process, right? Typically, sex isn't recommended for 2 weeks after a miscarriage to prevent an infection, Yeah, so another cause is infection that causing the miscarriage, right? Yeah. So you can ovulate and become pregnant as soon as 2 weeks after miscarriage. Yes. Um, a doctor would say, well, go for it, because we talked about yesterday, because your body is in a mood, um, a pregnancy, and your body now know that you can pregnant, and it's still in the functional mood that you pregnant. So you may get pregnant easy, but don't take the chance to risk it. Why is that? Because if we test that if your blood test show the iron is low, then I won't suggest to try anyway. Why is that? Because if your iron is low, that means your um, the lining, usual lining, is going to be thin. So the embryo won't implant properly. And that might be the biggest reasons that you lost your baby at first time. So if the iron is low, then we would suggest stop trying and take time to build up your iron first. Your iron level up, and we know that you've got enough blood, then therefore try the next pregnancy, start to prepare for conceive. So this is important. It's all dependent on what is the reason that causing your first miscarriage. Now, as a doctor, a lot of people then get advice from the doctor that they need to run the test not until the second time of miscarriage, and they start to get some tests done. So that is awful. So I always advise my patient, after just one miscarriage, you need to do some tests to rule it out what's going on, right? So before you get into conceive again. All right. Once you feel emotionally and physically ready for pregnancy after miscarriage, so this is important. So then you discuss with your health care provider for guidance, so how to start it again, all these things. So after one miscarriage, and they might not be a way to conceive, and that is in the conditions. If you rule out everything, you're all good. If you're just clotting issues, then hey, clotting issue, you can straight away go for pregnant, conceive again, because in this case we can use some. They would normally use some drugs, aspirins, when you're pregnant, and they give you a little bit of aspirin, and it actually works. It actually helps. And or you can prepare with Chinese herbs and acupuncture, and that will help as well. And guess what? Ginger are very, very good for thin the blood. It has the function, so more ginger, very good for you. All right. So after 2 or more miscarriages, your health care provider might recommend testing. You see, or the website, or the thing that it always tell you that after 2 or more miscarriage, after 2 or more miscarriage, your general, your GP and your doctor, family doctor, started suggest testing. And I against this, to be honest. I really against this. I say first miscarriage, you need to run all these tests to rule out all these reasons, what's causing it. And that's important. But most people, after 2 or 3 miscarriage, think about how painful is that for women who suffer from miscarriage. And you have to wait for 2 and happen again, or 3, and you start to do all the tests. And that is horrible. So if you're a practitioner, so I would strongly suggest get your patient to do all the necessary tests before it happen again. The chance may low, but we don't want to miss it. We don't want to risk it. Okay, so this is important. All right, if you are patient, when you watch this video, you'll know what we're talking about, and you can go back to the previous 2 video and check on it and see what is the risk and the cause and what's actually miscarriage. All right. So we're gonna talk about that's all for today. If you have any question, please put down there. And if you experience any miscarriage, or do you have how many tests that have you done, and when do you start to do the test before how many miscarriage that you went to before you started the test properly? Is it 1 or 2 or 3? In my experience in here, the first miscarriage, they don't do anything. They don't suggest any test for it. On my patient cases, after 2 or 3, and they started run some tests. So I strongly against that. And to be honest, and I don't know about your case, please leave your message down there, or if you're a practitioner, let me know how your country doctor work with miscarriage. I would like to know all this. So remember to give you a thumbs up, and on YouTube and Facebook, you can see that we have link to join our YouTube channel, as well as Facebook page, as well as Instagram, right? So don't forget to leave a comment. I'll see you tomorrow. Tomorrow we're going to carry on with miscarriage, and we're going to talk about what sort of test that we would normally do for miscarriage. Okay, so we'll keep it short. Okay, stay awesome, and I love you all. Bye bye.